And joining me now to talk about this topic is Dr. Shailene McNeil. She's NCBA's Executive Director for Human Nutrition Research. Dr. McNeil, I guess I would ask you, why are we engaging with MDs now as part of our health outreach program?
Well, you know, one of the things we've seen is that doctors are a very credible and trusted source of health and nutrition information. And more, they're seeing patients come into their clinics and their practices that have high blood pressure or high cholesterol, or they're overweight, and they're wanting to give them some advice. And what we're finding is that they have a little bit of an outdated advice on red meat. They kind of say, cut back on meat, and they don't have the latest science. So we want to focus on getting them that updated science, showing them how today's beef has become leaner over time. And it's something our producers have asked us to focus on. They've said, you know, we think doctors are a really important target audience, and we'd like you to emphasize them and really focus in, because they are making a difference in what people think about health and nutrition today.
So tell us more about how physicians do get involved in offering that advice that they may or may not be trained to provide, and how does beef fit into that advice?
You know, doctors don't get a lot of training on nutrition in medical school, and they kind of fall victim to what happens to consumers, is sort of just believing conventional wisdom. If you've been to a doctor lately, you know they have such a short time that they're spending with their patients, and so they're looking for really quick advice. And a lot of times through that, what ends up happening is they just say, cut back on beef or cut back on red meat. But what we've seen is that when they're very interested in nutrition, because they know it's a hot topic and they know it can make a difference with their patients. And when we can share with them studies that the Checkoff has supported, like the BOLD, the Beef in an Optimal Lean Diet study, that shows you can eat beef and lower your cholesterol as part of a heart healthy diet. That's important science information that helps them update their recommendations.
Really encouraging as well. So beef specific, what are the ways in which the Beef Checkoff is both engaging and educating these physicians?
We've really spent a lot of time to make sure we're focusing our resources on what are the best programs that we can do to reach doctors. And what we've learned is doctors are lifelong learners. They're expected to get continuing medical education throughout their career to keep their medical license. So they're always looking for ways to get those credits online or on webinars or in conferences. And they're interested in nutrition. So we've put together very good, high quality educational content that's brought to them by other physicians, because physicians like to learn from other physicians. So we've identified physicians who are up to speed on beef nutrition and are helping them see the science and understand how they can update their recommendations to recommend beef. It's been very successful reaching doctors with medical education.
Fantastic news. And so thus far, what have you learned in this project in working with these medical professionals?
You know, one of the things that we've learned about reaching doctors, because a lot of our programming has focused on registered dietitians and fitness professionals, and we're still doing that. Sure. But with doctors, they have a very limited amount of time, and they want to get right to the point on the science. So they're very interested in hearing what the science is. Sometimes I say, be brief, be bright, and be gone with physicians, as they like to get that information quick. So we're making short continuing education online that they can access and get a credit, webinars. Those things are very important. The thing for producers that they need to think about is doctors take a little bit more investment in resources. It's a little bit more expensive to reach doctors than it is to reach dietitians, but I think we're seeing that that's paying off, because they really are receptive to our nutrition messaging.
That's fantastic news, because I know a lot of people's beef consumption has been limited by what they've heard from doctors. So I'm thrilled to hear what you all are doing. Thank you so much.
Yeah, we're excited to have this program going.
Now, if you've got questions about beef as a healthy food choice, a good resource to check out is the Beef It's What's for Dinner website. There you'll find all sorts of nutritional information, along with healthy and nutritious beef recipes.